people with diabetes can have high risk of having cataract, high risk of having retinopathy, glaucoma. People are aware of their eyesight and they tend to go to the opticians to get your glasses done. So we're not talking about that. We are talking about mainly what we call the diabetes and retinopathy. Diabetes and retinopathy can set in right at the onset of diagnosis in type 2 diabetes. And in type 1 diabetes, it tends to happen 5 years down the line. So it's very important to get your eye or retina checked, which is back of the eyes, for looking for any new vessels or any leaky proteins or any damages around the main center of vision, which is macula. It's so important to get your eye test on an annual basis. It's not, people tend to again resist here that, look, I got your eye test by opticians. Yes, very good, well done. But it is very also important to get your eye retina checked as well, which is an annual test where doctors usually put an eye drop, wait for 30 minutes time and look in the back of the eyes by fundoscoping and look at the back of the eyes. It should be done on a regular basis. Now, if you have an eye disease, sometimes the doctor would recommend you a more specialized little angiogram test for the eye or looking for other tests, but it's very important from our point of view that it manages diabetes very well. Because once you already have a eye disease, it's very difficult to revert it. They sometimes do the laser treatment for it, try to destroy the new vessels which won't bleed. The laser treatment is not to get your eye vision back. Laser treatment is to make sure there's no further deterioration of your eye vision. And it's very important to, again, going back to the basics, a good HbA1c of 7 or below, and regular blood pressure control, and use of certain BP medications like Ramipril, or use of medications like Valsartan, Telmisartan also tends to protect your eyes. It's also important to control your cholesterol level as well, because it can indirectly affect your eye disease as well. And in certain situations that we also use statins and fibrates to protect your eye disease. So diabetes and eye disease is a fairly common condition. You should get your annual test done and get your dilated fundus examination, which is usually preceded by eye drop. Yes, you got your cataract done, that's fine, but you still have the retina, that's very important. So if you haven't cataract done, surgery done for your cataract for both eyes, still need to get retina annual examination done on a regular basis and keep in touch with your eye doctor. And if there are problems, we need to again make sure your sugar control is fine, and other medications sometimes can also protect your retina disease as well.